What is COVID-19? COVID-19 is an infectious disease, which means it can spread directly or indirectly from one person to another. Many people have mild symptoms and recover in 2 weeks. Older people and people with pre-existing health conditions are more at risk. Cases are generally mild for children and young adults. Most people recover fully from the virus, but the elderly or sick may not be able to survive infection. How is the virus spread? An infected person can spread the infection to a healthy person through eyes, nose and mouth, via droplets produced on coughing or sneezing, close contact with an infected person, or contact with contaminated surfaces, objects or items of personal care. What are the symptoms of the disease? Common symptoms are cough, fever, high temperature, breathing difficulties, and unexplained tiredness or fatigue. How I can protect myself against infection? By wearing a mask, washing your hands regularly with soap, by using a sanitizer and practicing social distancing. Practice and maintain good hygiene standards. What must I do if I have symptoms? If you think you may have COVID-19, isolate yourself away from other staff or family members until you can be tested. Contact your supervisor to arrange testing by the clinic. Keep wearing your mask and avoid touching surfaces unnecessarily. Proceed to the clinic for testing once your appointment has been confirmed. What is the screening and testing procedure for COVID-19? Everyone entering our premises must present themselves for temperature screening by our security personnel. If your temperature exceeds 38 degrees, you will be escorted to the clinic for testing. A positive diagnosis means that you will need to isolate yourself at home or at an isolation site until you test negative for the virus. You will also need to advise who you have been in contact with so they can be tracked and traced and put into quarantine, self-isolation at home or at a quarantine site to prevent the virus from spreading. This is what we call contact tracing. What PPE do I need to protect myself from COVID-19 in addition to my normal PPE? Wearing cloth masks is compulsory at TNPA. Wash your hands before handling your mask. Place the clean mask over your mouth and nose. Secure the mask by tying or placing elastics around your ears. Avoid touching your face during the day. Remove your mask with clean hands. Avoid touching the front panel. Wash your hands with soap and water or hand sanitizer after removing your mask. Store your mask in a sealed container until it can be washed. Reusable cloth masks can be washed in warm soapy water, sun-dried and ironed with a hot iron. What is the procedure to replace it if it is damaged or lost? Employee to immediately report to the supervisor or line manager. Supervisor or line manager to make arrangements to replace the lost PPE. What should I do before I go to work? Check that you are well by taking your temperature. Do you have a fever above 37.5 degrees Celsius? Do you have a dry cough? Do you have a sore throat? Do you have shortness of breath? If the answer is yes to any or all of these questions, stay home and contact the EAP toll-free number and inform your manager. What protective measures must I take on arrival at work? Wear your mask, including while traveling to work. Present yourself for temperature scanning by protection officers on arrival and thereafter as and when required. Answer the screening questionnaire. Practice social distancing. Keep a distance of at least 1.5 meters between you and others and avoid shaking hands. Time attendance will be recorded by line managers. How will I protect myself at work? Adhere to demarcations, floor stickers and barriers. Always keep a safe following distance of at least 1.5 meters from the next person. Bring your own food, cutlery and crockery. Maintain a 1.5 meter separation in eating areas, meeting rooms, offices, etc. Wash hands with soap and water or use an approved alcohol-based hand sanitizer after contact with any person or after contact with frequently touched surfaces, for example, phones, door handles, equipment, and after an exchange of documents, etc. Wet hands and apply soap. Rub hands together to create lather or bubbles. Spread soap to the back of hands, between fingers, rubbing nails onto palm. Lather for 20 seconds or more. Rinse hands and shake to dry or use a disposable towel. Move away from others if you are coughing or sneezing, and cough or sneeze into your bent elbow or into a tissue. Throw or flush used tissues away immediately and wash or sanitize your hands. If someone coughs or sneezes near you and droplets land on your face or hands, wash with soap and water immediately. Avoid touching your eyes, nose and mouth with unwashed hands. Avoid physical contact such as handshakes, touching and hugs. Do not share stationery, eating utensils or PPE. No storage of food or drink or personal items, for example coats and bags, in work area. Clean and disinfect surfaces and equipment with approved disinfection or sanitizing products on a regular basis, at least every 4 hours. Report to your supervisor or manager if you experience any symptoms: fever, cough, sore throat, difficulty breathing, or suffer from any of the following: body aches, loss of smell or taste, nausea, vomiting, diarrhea, or fatigue. Report health and safety matters to your SHE representative, such as any employees, visitors, and contractors who are refusing to take protective measures, to your SHE manager. What must I do when I leave work? Wash your hands before leaving through the door marked exit. Keep your mask on while traveling. When removing your mask at home, don't touch your face. Take off your work clothes and immediately wash your hands up to your elbow. If you feel sick, notify your supervisor or manager and immediately begin to self-isolate. If you need support, contact COVID-19 hotline 0800 029 999. Department of Health WhatsApp service, say hi to 060 012 3456. Transnet EAP 0800 000 408.